My name is Chelsea Hudson. I'm the founder of Cityscape Counseling. We are a group practice in Chicago with 11 excellent clinicians who specialize in treating eating disorders, obsessive compulsive disorder, mood and anxiety, trauma, and addictions, and we use a variety of evidence-based strategies. Today, I wanted to teach you a quick skill that I use with many of my clients. The skill is known as 4 options when in distress, and it comes from Dialectical Behavior Therapy, which is a treatment that was developed by Marsha Linehan. So before we know which of our 4 options we can use, we need to ascertain which part of the problem is in our control and which part of the problem is out of our control. Once we have identified what is in our control, we can use problem-solving strategies. Usually, we can generate a number of different solutions and weigh up the pros and cons. Once we have problem-solved what is in our control, we are generally left with 2 more options to approach what is out of our control. So our second overall option for when we are in distress would be to change our interpretation or perception of the problem, possibly find a different way of looking at our distress. If we are unable to do this, then our third overall option is radical acceptance. Radical acceptance does not mean that I like the problem or that I like the distress, but it does mean that I can acknowledge and allow that problem to be there. In this way, there is more room and space for it to breathe, and ultimately we reduce our suffering that is arising from refusing to accept the problem. The 4th and final option we have is unfortunately an option that many people choose. And this 4th option would be to do nothing different and stay just as miserable. In other words, we would continue to use the same maladaptive coping mechanisms that have been causing us to suffer. A lot of times these maladaptive coping mechanisms are avoidance behaviors, things like procrastination, distraction, addictive behaviors, disordered eating. I hope that next time you are facing distress that you will choose one of the first 3 options, either problem solving what is in your control or radically accepting or changing your interpretation of what is out of your control. Thank you for taking a moment in your day to watch this video. I hope you found it helpful.